The TANIA study was set up in order to investigate what happened if patients who received bevacizumab-based treatment for metastatic breast cancer would receive a continuation of bevacizumab-based treatment plus chemotherapy versus an interruption and a stop of anti-angiogenesis treatment with bevacizumab, but continuation with chemotherapy only. Roughly 500 patients were recruited into the trial. The results were impressive in that they showed that progression-free survival, a second progression-free survival, was significantly longer on the bevacizumab-containing arm as compared to chemotherapy only. The study was quite important because it showed a very nice difference between chemotherapy only versus chemotherapy in combination with bevacizumab, with the second progression-free survival being the primary endpoint of 4.2 versus 6.3 months. So we have a very, very nice result here showing that the continuation of anti-angiogenetic treatment would lead to a benefit for patients. Now, this is not truly biologically surprising, as we know from similar observations with other anti-angiogenetic drugs in other contexts that the inhibition or stop of anti-angiogenesis once it had been started would be truly harmful. So these results are very important as they constitute a new treatment standard once patients get into progression under bevacizumab-based treatment when they are suffering from metastatic breast cancer and should receive continued bevacizumab-based treatment in combination with a different chemotherapeutic compound. The IMELDA trial tested for the optimal way to maintain response in patients with metastatic breast cancer who were primarily treated with bevacizumab-based treatment with a certain chemotherapeutic compound. And it asked the question whether bevacizumab continuation alone or in combination with capecitabine would lead to a better result. Now, the combination arm of bevacizumab plus capecitabine resulted in a significantly better outcome for patients and a progression-free survival of more than 11 months as compared to 4.3 months with bevacizumab only. Now that is quite interesting, however, that you could maintain with bevacizumab only, although for a much shorter time period, but it is remarkable that this is the case. The overall survival was again very, very much in favor of the combination arm as compared to the bevacizumab only arm. And again, we have here something which is truly practice changing because we are having an important aspect to know how to proceed in patients, for instance, who would not tolerate taxane-based treatment in combination with bevacizumab, that we can very safely switch to another chemotherapeutic combination, maintaining the primarily rich response by a combination of capecitabine plus bevacizumab treatment while continuing bevacizumab as well. So in fact, these two trials show us that the combination of capecitabine or another chemotherapeutic compound plus bevacizumab continues good response and continues to maintain progression-free survival, prolonging it significantly when the chemotherapeutic compound is combined with the anti-angiogenic agent, which was used at the very beginning anyhow.